Top 16 dangerous diabetes signs you should know. Have you been feeling more tired than usual? Maybe you've noticed an unshakable thirst, or those moments when your vision suddenly goes blurry without explanation. These might seem like ordinary day-to-day issues, but what if they're actually signs of something more serious? Something developing in your body without you even knowing? For many people, especially over the age of 50, these symptoms can be the first red flags of a much bigger issue: type 2 diabetes. The truth is, diabetes can silently creep up on you without warning. That's why it's crucial to pay attention to these signs before they spiral out of control. Ignoring these warning signs now could lead to severe complications down the road. In this video, we'll cover 16 diabetes symptoms that often go unnoticed, so stay with me until the end to learn what to watch for. Don't miss out on these important signs that could make all the difference. If you think this content could help you or someone you know, hit the like button and subscribe. It really helps the channel grow, and you'll stay updated on more important health tips like this. Night sweats. Waking up in the middle of the night soaked in sweat isn't just a nuisance, it's a signal. For people over 50, especially those who feel mostly fine, this silent storm might be the first whisper of something serious. Many chalk it up to menopause, a warm room, or just aging, but what if it's not? What if your body's trying to warn you about type 2 diabetes before any blood test ever does? What's happening inside your body is a sudden drop in blood sugar, hypoglycemia, that hits while you sleep. People with undiagnosed type 2 diabetes may have unbalanced blood sugar levels that dip dangerously overnight, triggering adrenaline to jolt the body awake. This causes sweating, heart palpitations, and restless sleep. If this keeps happening and you're over 50, it's time to take it seriously. Because while one sweaty night might seem harmless, it could be the first sign in a long chain of diabetes symptoms yet to come. Leg cramps. Waking up to a sudden sharp pain in your leg can really throw you off. It's the kind of jolt that grabs your attention, especially when it happens in the middle of the night. For many over 50, leg cramps may seem like just an annoying part of getting older, but if they're happening frequently, they could be a sign of something more serious, one that's often overlooked. When blood sugar levels go haywire, as they often do in people with undiagnosed type 2 diabetes, the nerves and muscles in your legs can suffer. These fluctuations in blood sugar cause changes in nerve function, which can lead to those painful, uncontrollable cramps. If you're over 50 and experiencing these regularly, it's a signal you shouldn't ignore, because the root cause could be something that requires medical attention. Restless leg syndrome, RLS. The constant urge to move your legs at night, especially when you're trying to relax, can feel like a battle you just can't win. It's the kind of sensation that disrupts your sleep and leaves you tossing and turning, looking for relief. Often, people chalk it up to stress or a busy day, but if it happens regularly, it could be a sign of something more serious lurking beneath the surface. Restless leg syndrome is closely linked to fluctuations in blood sugar levels. When blood sugar levels spike or drop unexpectedly, they can affect the nervous system, causing that uncomfortable tingling, aching, or crawling feeling in your legs. If you're dealing with this persistent discomfort, it's more than just an annoying quirk. It could be your body's way of signaling that something's off with your blood sugar, pointing to a deeper issue that might require attention. Sleep apnea. Waking up feeling like you haven't slept a wink, gasping for air, or with a dry mouth can leave you wondering what's going on with your sleep. For many, this is more than just a bad night's rest. It could point to sleep apnea. This condition, where your breathing briefly stops during sleep, disrupts the quality of your sleep, leaving you feeling exhausted and drained the next day. For those with diabetes, especially when it's undiagnosed, the effects of sleep apnea can worsen blood sugar control. The interrupted breathing puts stress on the body, causing blood sugar levels to rise, which in turn can affect your overall health. If you've noticed these symptoms alongside other signs of fluctuating blood sugar, such as increased thirst or frequent urination, it's time to pay closer attention to your sleep and its impact on your health. Frequent nighttime urination, nocturia. Waking up in the middle of the night with an overwhelming need to pee can be more than just a nuisance. Nocturia, or frequent nighttime urination, disrupts sleep, leaving you feeling unrested and drained in the morning. While it's easy to brush it off as simply drinking too much water before bed, it can actually be a sign of something deeper at play, particularly in individuals who may be dealing with imbalanced blood sugar. When blood sugar levels are elevated, the kidneys work harder to filter out the excess sugar, leading to an increased need to urinate. This can cause frequent bathroom trips throughout the night, disrupting your rest. It's important to pay attention to this pattern, especially when combined with other changes in your body. If nocturia becomes a regular occurrence, it's time to take a closer look at your health and consider the connection to blood sugar management. Excessive thirst. If you've noticed an unexpected increase in thirst, no matter how much water you drink, it's not just a sign that you're dehydrated. Constant thirst, especially when paired with dry mouth, is a common symptom of diabetes. The body struggles to manage excess sugar in the bloodstream, and as a result, it draws water from tissues to dilute the sugar, leading to the sensation of extreme thirst. This heightened thirst is often accompanied by frequent urination, as the kidneys attempt to rid the body of the extra sugar. If you find yourself reaching for water constantly, it might be a sign that your blood sugar levels are out of balance. While it's easy to dismiss as simply needing more hydration, persistent thirst can actually be a clear sign that your body is signaling an imbalance. Pain or numbness in the legs, peripheral neuropathy. If you've ever experienced tingling, burning, or numbness in your legs, you know it's more than just an uncomfortable sensation. It can be downright alarming. This type of pain is often associated with peripheral neuropathy, a condition caused by nerve damage, and is particularly common among people with diabetes. High blood sugar over time can damage the nerves, especially in the extremities like the legs and feet, leading to a feeling of electric shock or pins and needles. This nerve damage can worsen if blood sugar levels are left uncontrolled, and while the pain may come and go at first, it can gradually become more persistent. If you're experiencing this type of discomfort, even if it's mild, it's important to take note. Early intervention can prevent the progression of this condition, potentially avoiding more severe symptoms that can affect your mobility and quality of life. Nighttime hypoglycemia, waking up in the middle of the night feeling shaky or disoriented. It could be more than just an odd dream or a side effect of your dinner. For those with diabetes, nighttime hypoglycemia, or low blood sugar, can sneak up without warning. The body's sugar levels can dip too low while you're sleeping, leading to symptoms like sweating, confusion, and an unsettling feeling of dizziness, all of which might be mistaken for something less serious. The tricky part? Many don't realize they're experiencing hypoglycemia until the body's reaction is in full swing. In some cases, the symptoms can become severe, affecting how well you sleep and your overall health. If you find yourself waking up with these symptoms repeatedly, it's a good idea to monitor your blood sugar levels more closely, as unchecked hypoglycemia could disrupt your sleep cycle and lead to bigger problems in the long run. Insomnia. For some, the night is a battle they can't seem to win. Insomnia, a persistent difficulty in falling or staying asleep, affects many, especially those with unmanaged diabetes. Blood sugar levels that are too high or too low can keep you tossing and turning as your body struggles to find balance. When your blood sugar isn't in check, the symptoms of insomnia can intensify, leaving you more exhausted each day, unsure of what's causing the unrest. The most frustrating part is that this restless night after restless night often goes unaddressed. You might be chalking it up to stress, aging, or just a busy life. But if the sleeplessness persists, it could be signaling an underlying problem with your blood sugar, which deserves attention. By managing your diabetes, you can find relief and restore your natural sleep rhythm. Acid reflux. Imagine lying down to rest after a long day only to be jolted awake by a burning sensation in your chest. Acid reflux or heartburn can be especially troublesome at night, and for those with diabetes, it can become a common issue. Elevated blood sugar levels can relax the lower esophageal sphincter, the muscle that keeps stomach acid where it belongs. As a result, stomach acid can move upward, causing discomfort and sleep disruptions. For many, this means waking up repeatedly with a sour taste in their mouth or an uncomfortable burning sensation in the chest. Although it might feel like just another discomfort, acid reflux can become chronic, especially if blood sugar isn't properly managed. If you've been dealing with persistent nighttime heartburn, it's worth considering whether diabetes is playing a role in this ongoing issue. Taking steps to control your blood sugar levels might just be the key to reducing acid reflux and improving your quality of sleep. Nightmares or vivid dreams. Have you ever woken up from a nightmare, your heart racing and your mind scrambling to shake off the images? Nightmares or vivid dreams can be more than just the result of stress or a heavy meal before bed. They may be linked to imbalances in your blood sugar levels. For people with diabetes, especially those with fluctuating blood sugar levels during the night, the brain can be triggered by these changes, leading to more intense and unsettling dreams. These nocturnal disturbances can disrupt sleep, leaving you feeling groggy and unsettled the next day. This connection between blood sugar and dreams isn't just coincidence. As blood sugar levels swing throughout the night, they can create a cascade of reactions in the brain that result in unsettling dreams or nightmares. Managing blood sugar levels may not only help improve your sleep, but also give you the peaceful rest you deserve without the fear of waking up in the middle of a bad dream. High blood pressure in the middle of the night. Imagine waking up in the middle of the night with a racing heartbeat and a sense of unease, only to realize that your blood pressure is through the roof. High blood pressure, especially during sleep, may seem like an invisible issue, but it's a silent problem that can affect your overall health. For those with undiagnosed diabetes or fluctuating blood sugar, this spike in blood pressure during the night could be a direct result of the body struggling to manage its glucose levels. It's the body's way of reacting to an imbalance, even when you're sleeping. This phenomenon can be a serious concern, as high blood pressure puts a strain on your heart, arteries, and organs. If this happens regularly at night, it's important to monitor not only your blood pressure, but also your blood sugar levels. Identifying and managing both could help prevent more serious health complications in the future, allowing you to rest easy and wake up feeling refreshed. Palpitations. You've just drifted off to sleep and suddenly you're jolted awake by an irregular, rapid thumping in your chest. Those heart palpitations aren't just a random occurrence, they're often linked to imbalances in blood sugar levels. When your blood sugar spikes or drops, your body reacts, sometimes causing your heart to beat faster or erratically. For people with undiagnosed type 2 diabetes, this can happen more frequently, especially at night when the body's sugar levels are fluctuating without you even realizing it. While palpitations can be triggered by many factors, stress, anxiety, or caffeine, their recurrence, particularly when paired with other diabetes symptoms, might indicate a deeper issue. If you experience this unsettling sensation regularly, particularly at night, it could be time to take a closer look at your health. Addressing your blood sugar levels and seeking appropriate medical advice could provide you with more peace of mind and ultimately, better heart health. Teeth grinding. Waking up with a sore jaw or the feeling of tightness around the mouth might seem like a minor discomfort at first, but if this happens regularly, especially in the morning, it could be a sign of something more. Teeth grinding or bruxism often occurs during sleep, unnoticed by the person. This is more common in people with fluctuating blood sugar levels, like those with undiagnosed type 2 diabetes. When blood sugar drops overnight, the body experiences stress, which can lead to involuntary clenching or grinding of the teeth. The body may not show obvious signs of hypoglycemia, but the jaw tightness could be an overlooked signal. The consequences of grinding teeth during sleep are not limited to morning discomfort. Over time, the continuous clenching can cause tooth wear, jaw pain, and even damage to dental work. The trigger for bruxism could be low blood sugar during the night, affecting the nervous system and causing the body to react in this way. This subtle symptom is often overlooked, but for those over time dealing with unexplained jaw pain or constant headaches, it may be worth considering blood sugar levels as a possible factor. Morning headaches. Waking up with a headache, especially one that feels like a tight band around the head, isn't just a sign of a long night or dehydration. For those who experience it regularly, this could be another indication of imbalanced blood sugar levels. When blood sugar levels drop too low during sleep, the body can go into a stress response, triggering the release of hormones like cortisol and adrenaline. These hormones can cause the blood vessels in the head to constrict, leading to tension headaches when you wake up. While it may feel like a harmless way to start the day, morning headaches are more common in people with fluctuating blood sugar levels and could be an early sign of something more significant, like type 2 diabetes. If you often find yourself reaching for pain relievers to get through your mornings, it's worth considering whether these headaches might be linked to your blood sugar levels. Persistent morning headaches could indicate that your body is struggling to maintain stable glucose levels overnight. Instead of relying on temporary fixes, addressing the root cause, like stabilizing blood sugar levels, could help prevent these painful mornings from becoming a recurring problem. Blurred vision upon waking. Waking up with blurry vision can feel like a normal part of getting out of bed, but it could signal something more. When blood sugar levels fluctuate overnight, the tiny blood vessels in your eyes may swell, This swelling can alter the shape of your eye's lens, leading to temporary distortion in your vision. The blurriness often clears up once your blood sugar levels stabilize throughout the day. However, if blurry vision becomes a frequent issue, it could be a sign that your blood sugar is not properly regulated. Chronic blood sugar fluctuations are a common symptom of type 2 diabetes, and monitoring these changes can help identify potential health concerns. If you experience this regularly, it's worth discussing with your doctor to rule out any underlying issues. Remember, the signs of diabetes can be subtle, and many of these symptoms are easily overlooked. If you're noticing any of these warning signs, it's crucial to take action now. Don't wait for things to get worse. Early detection can make a significant difference in managing your health. Stay aware, stay informed, and always consult with your healthcare provider. Thanks for watching, and make sure to subscribe for more valuable tips.